How to pierce your own penis. Piercing your penis can be an excellent way to ramp up your sex life, feel good about yourself, and get a piercing that nobody knows about. It's not for everyone, but if you think you might be interested, then read on. Method 1. Researching. 1. Do some research. There are many different types of piercings you can get on or around your penis. Some of the most common are Prince Alberts, Ampellings, Freenhams, and more. Look them up and see what you think sounds best. Google image search will usually help you sort out the basics. 2. Read up on blood-borne pathogens and the potential risks of piercing yourself. Getting this done at home can lead to all sorts of diseases that can risk your health, as well as the health of your package. If you want to ever use that thing again, go about this very, very carefully. Dong rot is nothing to joke about. This is the only body you've got, so don't ruin it. Also read up on your local laws. In most places, you must be 18 years or older to get piercings without an adult accompanying you. Please be responsible. 3. Decide on what size or gauge you would like to be pierced at. Piercing sizes generally follow the American wire gauge standard, in which a larger number represents a smaller size. For example, genital piercings are typically done from a size 16 to about a size 12, though there are always exceptions. A 14 gauge is about 1/16. 4. Order your surgical steel piercing needles. Make sure to get the correct gauge size for your piercing. Most tattoo piercing shops won't sell you piercing needles due to liability issues, but you can order them online without too much trouble. Make sure you are getting them from a reputable source and that the packages come entirely sealed, because you can get some very serious diseases from unhygienic needles. As we said, dong rot is not something to joke around with. 5. Get your titanium or surgical steel jewelry. Make sure it is the right size and shape for your new piercing. Barbells or rings for a Freenham ladder, a curved barbell for a Prince Albert, etc. Keep in mind the length of jewelry that you will need. Having jewelry that is too small can cause significant problems while healing, so if you're not sure, get something a little bigger just in case, that way you have some extra room if it swells, and it will most likely swell. 6. Get other tools. Depending on the piercing, it might be useful to buy a pair of clamps as well. Sometimes it can be very difficult to hold the head how you want it, especially in places like the scrotum or the shaft of the penis. These clamps allow you to mark your spot, then clamp the skin just how you want it so you don't have to worry about it slipping and moving while you are trying to pierce. Piercing in the incorrect location can cause serious bleeding or worse, permanent injury, so clamps are a good idea. This is one reason why it may be good to get it done by a professional. Placement is very important, and experience will go a long way towards helping with getting your piercing where it should go. 7. Get gloves and other safety supplies. You can order gloves from these sites as well. They are very important. You must be sure to take any possible precaution against the spread of blood-borne pathogens and other infectious diseases. Alcohol wipes are good as well to sterilize and clean the skin around your potential piercing spot. Also, it's very useful to get some AD ointment to lubricate your needle. It makes it a lot easier when you push it through the skin. Remember that all the alcohol wipes in the world may not help. In fact, even alcohol wipes can become contaminated. Professional equipment is useful for this reason. Method 2. Preparing. 1. First you must decide on a location to get your piercing done. Choose an area with a good bit of flat space that you can work with and a good counter. A bathroom is a good place. You'll also want an area that is easy to sterilize and clean up all the blood when you're done. 2. Sanitize everything. First of all, make a solution of 1 part bleach and 4 parts water. Clean the bathroom thoroughly. Scrub any area that you think you might touch during the procedure. Clean every inch of the counter. The cleaner this place is, the safer you are. 3. Don't neglect your jewelry. If you bought sterile clamps and jewelry, then great, but if not, it might be a good idea to boil these in a pot of water, then wipe them down with some of your bleach and water solutions. It's probably a good idea to sterilize these regardless, since you don't know what they may have come into contact with since you got them. 4. Prepare your supplies. Once everything is clean, put on a pair of gloves and lay out all your supplies. Extra gloves, sterile needle, sterile clamps, sterile jewelry, alcohol wipes, a marker, and a small blob of AD ointment. Remove your gloves and throw them away. 5. Clean the surrounding skin. Now, put on a pair of fresh, clean rubber gloves. Use an alcohol wipe to clean off the area where you want to pierce yourself. 6. Mark the entry and exit locations. Use a marker to make 2 dots, one where you want the needle to go in, and one where you want the needle to come out. Make sure that these dots are a suitable distance apart for your jewelry. Take a step back and imagine it with jewelry in it. Make very sure that it is straight and just how you want it, because it is a pain to have to take it out and redo it all over again. Realize that marking these dots does not guarantee that this is where the jewelry will go. If you move, due to, for example, serious pain, you might shift the needle and end up with a crooked piercing. A good reason to have someone else do this for you. 7. If everything looks good, take off your gloves and throw them away. Put on a fresh pair. 8. Apply the clamps. Now take your clamps, if you have them, and stretch out the skin in the place you have marked. Line up the 2 dots on either side of the skin and gently let the clamps close on the skin. You should be able to see 1 dot on each side of the clamp, and each dot should be centered so that a straight line, a needle, could pass through both of them correctly. This method is better suited to only certain types of penis piercings. For PAs, you'll need to use a different method. They are harder to do and really should be done by a professional. 9. Alternatively, stretch the skin. If you didn't buy a clamp, this would be a little trickier. You must use one hand to stretch the skin and line it up like above so that a straight line could pass through both. It can be tough to hold the skin like this when you are coming at it with a needle in the other hand, another reason to have it professionally done. Method 3. Piercing. 1. Get out your needle. Once you've got your clamp latched on, it's time to unpackage your needle. You bought a sterile piercing needle that matches the size of your jewelry, right? If not, stop now. Go get the right size. Make sure you buy it sterile. If the packaging is damaged, get a new one. This is not the place to be lazy. 2. Apply ointment. Once you've got your needle out, rub on just a little bit of the AD ointment. This will make the next step easier. 3. Line up the needle. Okay. Now double check to see that both marks are still lined up in the clamp. If they are, then hold the clamp in one hand so that you can clearly see your mark. Now with the other hand, take the needle over and line it up on your mark. You can hold the sides of the needle between your thumb and middle finger and use your index finger on the back of the needle to push through, but hold it whichever way is steadiest and most comfortable for you. 4. Pierce the skin. Now, take a couple of deep breaths, check to make sure you're lined up correctly, and quickly push the needle through the skin till you see it poking through the other side at least a centimeter or 2. Make sure you don't push the entire needle out the other side, because we will use the needle to guide the jewelry in. Pushing the needle through your skin will hurt. Very beefy dudes cry like babies during this type of piercing. You just have to push all the way through. It's very hard to keep going once you feel that initial pain, but it doesn't get any worse than that first little bit of pain, so you might as well just keep going so that it's all the way through, rather than going to all this trouble and not even having a piercing to show for it. If it hurts, just push through a little harder. It will stop hurting very quickly once you get through to the other side. 5. Insert the piercing. Great! Now that you've got the needle through, the hard part is over. Now you just have to put the jewelry in. You still have the needle sticking out both sides of the hole, right? I bet it looks pretty cool, but now it's time to put in your jewelry. So, unscrew or remove a ball from one side of your jewelry. Don't lose it. Now take the threaded ball, left side of your jewelry, and line it up inside the back of the hollow needle. It should fit in there just fine. Now you can use the jewelry to push the needle the rest of the way out, and the jewelry will follow right into the hole. 6. Secure your jewelry. If you did everything correctly, you should see the threaded end of your jewelry poking out the exit hole of your new piercing. Now just screw that ball on and you're good. Take the time to clean the area with another alcohol wipe. 7. Dispose of your needle correctly. If you bring it to a piercing shop or a hospital, they will gladly dispose of it for you. If you absolutely cannot get it to one of these places, then put it in a hard plastic container, such as a prescription pill bottle, and throw it away. Be considerate, this is considered biological waste, and it's not fair to put your garbage collector at risk. Method for aftercare. 1. Take care of yourself. Congratulations, you're pierced. Now you just need to take care of it properly. You should soak it in a solution of warm water and sea salt for the first couple weeks. When taking a shower, it is a good idea to use an anti-microbial soap just in case. 2. Be careful around water. Showers are fine, but try to avoid baths or swimming during the healing process since it is easier to get infections from sitting water. 3. Slow down on the sex, tiger. With genital piercings, you should not have sex for at least 4 weeks or so. You have an open wound on your penis, so keep that in mind. You are much more susceptible to STDs during the healing process, and having unprotected sex makes it much more likely to get an infection. So wear a condom every time for at least 2 months, whether you're in a committed relationship with other forms of birth control or not. This is for your safety. Also, remember you have metal down there, so it might not be a good idea to use sheer or extra sensitive condoms as they may break more easily. 4. Ask if you have any questions. Enjoy your new piercing, and if you have any questions, ask your local piercer. They are more than happy to give you advice. They want everyone to be safe. Tips. If you are ever unsure about anything you're doing, stop. Ask a professional piercer. Piercing yourself can be very dangerous. You do this at your own risk, and you are responsible for any injuries, infections, deaths, or otherwise unhappy events that may take place. See a professional piercer. Some of the advice here is dubious, especially on the area of sterilization. Alcohol swabs do not kill all viruses or bacteria.